Today we are going to go over a rather personal subject. We are going to talk about ACL ruptures and ACL tears. I went through this in 2010. I was playing basketball. I took a sideward step and my knee just buckled and there was this nasty little pop and then I just went down to the ground. That was pretty nasty pain. I was able to get up and walk away, so I thought I was okay. I then went to the doctors. They then had me get x-rays. They then had me get my most favorite thing in the world, which is an MRI. The MRI revealed that I had a complete tear of the ACL. I then had to reestablish my range of motion, to only then have surgery, and then to have to get all that range of motion back again. I had to learn how to walk properly again and run. This took about 6 months before I could actually get up and run around somewhat. It took me basically a full year to get back to full functional movement like I did before I tore my ACL. Yeah, because we just can't always have a lucky Irish. Alright, this is the knee. The ACL is basically located in the middle of the knee joint. It is connected from the femur to the tibia down here. It is behind the patella and the patella tendon. Basically what they did is they took 2 rods and they shoved it through there, and then they re-sewed the tendon in the middle in there. I had the option of getting my hamstring muscle taken out and put in there, or them to cut up my patella and put it in there. I chose the third option, which was basically to put a cadaver inside of there, so it's basically like dead muscle tissue, so I have some zombie in me. Alright, we're going to talk about possible causes that happen to affect the ACL and cause it to either tear or rupture in everyday movement. One of the biggest problems is letting the knees internally rotate, either from standing or when you bend down or when you go up and down from a jump and you land more like this. Or the way I tore it was basically when you step sideways, you let the knee kind of internally rotate such like that. Like I said, the basic thing to always try to pay attention to with the knees is always make sure that when there is bending or sideward stepping, that the knee tries to always stay in line with the second and third toe. Very fluid motions, and like if you step sideways, try to not let the feet internally rotate or externally rotate. Just keep it nice and straightforward so that the knee goes in line with the second and third toe as always. Because basically what this is doing when you do the internal rotation of the knees, the femur bone right here and the tibia bone right here, where the ACL is connected in the middle right here, is kind of taking the ligament like this, and instead of keeping it nice and straight like this, it's turning it like this and creating a torque. And then when you go back up, it kind of just has to whip like this. And once wouldn't be a problem, but the consistent twisting like this, eventually the ligament just gives way. Like I said, luck of the Irish, and you just weren't lucky that day and you twisted it and bent it the wrong way and it just pops. Yep. Alright, now we're going to talk about muscles that you might want to foam roll and stretch to help with the alleviation of the pattern distortions that you suffer from that may cause your ACL to tear or just cause trauma to the area inside of your knee and other ligaments in there. These muscles would include the inner thigh or also the abductor muscles. You need to also foam roll pretty much most of the calf muscles, in particular the lateral gastrocnemius. Muscles that you want to strengthen to help fix the internal rotation of the knee would be the gluteus medius muscles. You need to strengthen the hamstring muscles and the posterior and anterior tibialis muscles. This will help with the internal rotation and then also help getting the tibial muscle to not internally rotate and external rotate. Yeah, because this is a very highly likely injury in most of the population. It is a very common in females, a lot more common in females than it is in men. A lot of times this is just a non-contact injury, just people plant their foot or they plant and twist their knee and their ACLs either rupture or tear. Yeah, this is a very simple procedure to go through. The recovery time is very nasty and there's a lot of physical therapy involved. And the worst part about this injury is the mental damage in which it does on people. A lot of people go through a lot of doubt and depression. It tends to make them question if they're ever going to be able to walk again. A lot of athletes don't come back so confident from these injuries because they're afraid to either go through it again or they just don't feel as if they are the same after it. So yeah, this is just an all-around horrible thing to go through, and I hope I never go through it again, and I really hope you're lucky enough to never have to go through it either. Happy St. Patrick's Day.